What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heart. Your heart beat too fast. Sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a platinum medication indefinitely for the rest of your life. Back to normal. Yeah. Sometimes people have AFib, but they don't blood thinner medication yet because they don't have any additional risk factors such as or have high blood pressure, diabetes. Generally, if you have only atrial and you do not have any additional risk, and you don't have to take the blood thinner medication yet, they may put you on baby aspirin. So have a AFib, your doctor need to select one of the oral blood thinner medication. If your AFib is not regular, you may start with the Eliquis, Xarelto, or Badax for your convenience. You don't have to do the frequent like warfarin. If your AFib is very regular, then you have to take warfarin. So it is depend on what type of AFib, and your doctor might put you on the best medication. If you have any further questions on this, please a comment in the comment box below. Thank you. Protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If you know the cause of a protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, dabigatran. Antithrombin or AT deficiency treatment duration. This is the blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is coagulable states. There are two types of factor V latent deficiency. First one is homozygous factor V latent deficiency. This is high single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you might need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous. This is a major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take a blood thinner medication indefinitely, regardless of having a blood clot in the past. The best medication for this indication is warfarin. There are ongoing study for the other medication such as Eliquis, Xarelto, Adaxa indication. If you have a question, please let in the comment box below. Thank you. antiphospholipid, anti-AAS coagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Coumadin. You should avoid taking Eliquis, Xarelto, Adaxa. If you have any further question, please let me know in the comment box. Thank you. Disease. You may need to take a blood thinner medication, have a history of blood clot. How long on blood medical condition you need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot in your lung or the cause of the blood clot, you may only need to take a blood thinner medication for about 3 to 6 months. If that is the first time you have a blood clot in your lung. If you don't know the cause, don't know why you have a blood clot in your lung, and if that is the first time you have a blood clot in your lung, you have to take a blood thinner medication for 6 to 12 months. If you have a second time blood clot in your lung or recurrent blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that considered recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication longer, maybe for the rest of your life or definitely. And finally, if you have a blood clot in your lung and it's related to an active cancer, then you may need to take a blood thinner medication until you no longer have cancer, and at least for 3 to 6 months. A blood thinner medication at least for 3 to 6 months, and until you no longer have active cancer. If you have any further question about this, please let me know in the comment box below. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how long you have to be on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? You have to take a blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life. If you don't know what is the cause of the blood clot in your leg, then 6 to 12 months, if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is the general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. Mitral valve treatment duration. If you have mechanical mitral heart valve, you may need to attention for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you may only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is the general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment period and duration. If you have any further question, please let me know in the comment box below. Thank you. Transient ischemic attack (TIA) or mini stroke treatment duration. So the duration, it could be clinical adjustment. So it depends. After the TIA, you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further question, please let me know in the comment box below. Thank you. Aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a platinum medication indefinitely for the rest of your life. The best medication is warfarin. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you might need to take a platinum medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a platinum medication. You have aortic heart valve, your cardiologist will tell you exactly how long you have to be on a platinum medication or an aspirin. If you have any further question, please let me know in the comment box below. Thank you. Stroke and blood thinner medication treatment duration. So if you have a stroke and you have to take a blood thinner medication, you know how long you have to be on a blood thinner medication. If you know your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take a blood thinner medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, then you don't have to take a blood thinner medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a blood thinner medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV thrombus, may need to take a blood thinner medication for at least 3 months. The best medication, the best blood warfarin. So if you have a history of dilated cardiomyopathy and now you have a blood clot, such as blood clot in your leg or blood clot in your lung, or you have an atrial fibrillation, then you may need a blood thinner medication indefinitely or for the rest of your life. If you have a history of dilated cardiomyopathy, and now you have a left ventricular thrombus, then you may need to take a blood thinner medication for at least 3 months. The best blood thinner medication is warfarin. You should follow your cardiologist's instructions for treatment, therapy, and duration. If you have any further questions, please let me know in the comment box below. Thank you. Bye. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heart beat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a blood thinner medication indefinitely for the rest of your life, unless your cardiologist can convert your heart back to normal. But that's very rare. Sometimes people have AFib, but they don't start the blood thinner medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the blood thinner medication yet. They may put you on baby aspirin. So when you have a AFib, your doctor need to select one of the oral blood thinner medication. If your AFib is not regular, you may start with the Eliquis, Geroto, or Badaxa for your convenience. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, then your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. Protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or if you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or abicipar, Geroto, rivaroxaban, Adaxa, dabigatran. Antithrombin or AT deficiency treatment duration. This is the blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you might need to take a blood thinner medication the rest of your life, especially when you have a blood clot in your leg or your lung. The best medication for this indication is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor laden deficiency. First one is homozygous factor V laden deficiency. This is my single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you may need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V laden deficiency is heterozygous. This is the major or multiple risk of having blood clot.